3, inadequate concentration of oxygen. The patient is restlessness, agitation, confusion, dyspnea. Intervention. Monitor signs of hypoxia. Right? Come on, guys. O2 sat. Administer oxygen. Encourage coughing and deep breathing. So these things that can happen after surgery. Pulmonary embolism. Dbt, right? Let me explain to you. A thrombus is found in the vein. Look, when you move, the thrombus moves and it becomes emboli. The thrombus block goes right into the lung, and that is called pulmonary embolism. So it first starts with DVT, right? DVT gives PE, and the DVT in the back of your page. So pulmonary embolism is an embolus blocking the pulmonary artery. So nursing intervention. Pain. What is causing the pain? A clot. So students give the patient morphine. No. You're going to give the patient heparin sulfankisa. The bull. Yes. Okay? So give heparin first. Right?
Prevent or form? Prevent?
No. Heparin break. Clot. Lovenox.
What about the light chocolate?
Let me give you. Lovenox prevent. So after surgery, you want to give me Lovenox so I don't get Ebola.
Oh.
But si gen Ebola, ou besoin friendly avec heparin.
Oh, what about the chocolytic?
Chocolytic, not chocolytic. What you want to say, thrombolytic.
Thrombolytic, yeah.
Active place, streptokinase. They are, yes, they break clot, but they have a lot of adverse effect. Thrombolytic, streptokinase, active place, right? The one that ends with vase. If a patient have a PE, on thrombolytic, ma baou heparin, because thrombolytic has a lot of adverse effect. Because if you have hemorrhage, ischemia, stroke, if the stroke past 4 hours, you cannot give me thrombolytic. You give me thrombolytic, you just kill me. You see that? So yes, you give thrombolytic, thrombula, but they got a lot of problems, which we'll learn that in cardio.
Okay.
Any question? Okay, so you will give heparin, IV, monitor vital signs, okay? Hemorrhage meaning you bleeding more than what? 500 cc. Pile sang. After surgery, you hemorrhage. What's priority? Fluid. After surgery, if the patient hemorrhage and they have infection, that is called sepsis shock. Septic shock is droplet precaution. So you will wear glove and mask. You will not wear gown for sepsis. That's an NCLEX question. Hemorrhage, fluid. Sepsis, priority is infection. Yes, but it's droplet precaution. Sepsis, say droplet precaution. You will wear glove and mask. ou pas mettre gown for sepsis shock. The key word sepsis. Student toujours put contact for sepsis. Be careful. Any question? Sepsis. Shock. Shock. Attendez. Hemorrhage, my base son. I'm bleeding. Shock is, I don't bled so bad that oxygen not flowing. Sepsis, shock, meaning no oxygen, because no oxygen, no fluid. Bacteria infection went into my blood. So there's 3 English: hemorrhage, shock, and sepsis shock. 3 anglais. Hemorrhage, my base son. Shock, meaning I gave blood so bad, no oxygen flowing. Sepsis shock is because I gave blood so bad, I'm bleeding, no oxygen flowing, bacteria now goes in the blood, you will lay sepsis shock. Yes. Sepsis. Droplet precaution. Glove and mask. Yes. All of them. Shock is hypovolemic, is low blood. Hemorrhage. No. Comprendre. Hemorrhage is hypovolemic. When they say shock, some people say hypovolemic shock. Because of low volume, I have shock. Fluid and mettez tête en bas. Yes, tête en bas, not reverse. Reverse Jordan means tête en l'air. Hold on, wait a minute. Shh, be quiet. Hold on, let me attack her and I'm gonna come to you. Now, hemorrhage, I'm bleeding more than 500. Because I'm bleeding more than 500, no oxygen flowing. That is called shock. Some people label it hypovolemic shock. Now, because I'm bleeding and I'm not getting oxygen, I'm in shock, infection, right? Get into the blood tract. That is called sepsis. Why don't you ask me for each one? Hemorrhage, priority, fluid. Shock, priority is oxygen. Sepsis, shock, priority is antibiotic. Comprendre. Now, when you say Schrodingenberg, that is tête en bas, pied en l'air. Reverse it, tête en l'air, pied en bas. So when you say reverse, that's high power. So you got to be careful. When I have hypoxia and I have shock, you want to put me Schrodingenberg. Any question? Yes.
And shock, you say conversation.
Schrodingenberg.
But in the book, it's the NCLEX.
Lord, what is Schrodingenberg?
Oh,
Elevate the leg. Tête en bas, pied en l'air. That is called what? That's it. Hemorrhage. No. Be quiet, because we going crazy. Be quiet. Listen. When you hypoxia or shock, You don't have oxygen. You put me Trodenenberg. That means elevate the leg, put head flat.
Oh, no, okay, but you could elevate the leg, you don't put the head flat. That's how I understand it.
Yeah, but si vous dites elevate the leg, côté tête la pour aller. Non, baby, non, baby. Ça, c'est plus comprendre. Si vous dites mettez tête pied en l'air, côté tête la pour aller chez lui.
No, but she thinks it's just a payload.
Oh, no, Trodenenberg. Now I got what you think. Okay, now, let me talk about hemorrhage, because I heard somebody say, hemorrhage, elevate the leg, Trodenenberg. I never said that. Anytime somebody hemorrhaging, ou mette tête sur bleeding, and you put the head flat, you might kill them. I said priority for hemorrhaging is fluid. That's what Sonia Gayard said. I never said put somebody hemorrhage in Trodenenberg position. Mbafu, I'm alert on time 50. She even asked me, I broke it down simple. I said when you hypoxia. Oh. If I'm hemorrhaging, ma base son en tête, ou mettez tête en bas, et touillez, ou sont touillez. I have headache, you put me head flat. What you just did, kill me. But, let me help you. Watch. I'm hemorrhaging in the brain. Position me. High faller, you just gave me ICP. Semi-faller, 15 to 30. Yo te bali nan l'école là. Yo te bali, yeah. Come on, people. ICP. I have ischemia, stroke. Position me. Flat. Med-surg neuro. I got hemorrhage, stroke. Position me. 15 to 30 degrees because of ICP. Come on. Okay? Any question? Turn. DVT, to prevent, you will put TED stockings. So here's one of your skills, how to put TED stockings. You give Lovenox to prevent. I'm going to say it in English. Hey, si poko gen boule la, pou ki sa wey bom heparin? To prevent? DVT, I just had surgery. What drug you gonna give me? Lovenox. How come you didn't give me heparin? Because there's no clot. Lovenox prevent, heparin prevent and break. The only time you give the patient heparin after surgery, if that patient got history of clot. Comprendre? Right? Guy, you see what get won't be mon kale prend test mon yo pa passe ou pa ka fâché non mon wè ça dans classe là. Our critical thinking is extremely low. We need to boost up. You cannot get mad. The result you get is the right result. Soon as you understand, you're going to see a whole different result. Don't get mad at the numbers. The numbers don't lie. And I can see it in the class. Yes, we read. If I stand up here and say y'all don't read, I'm lying. You read, but you don't understand, and it's hard for someone to change you. Especially if you are LPN, can't nobody tell you nothing. And that's why all the LPNs go and fail. Do you know the number one nurses that fail RNs and LPN? The best nurse is a person like me. I wasn't a nurse. I was in CNA, I was nothing in nursing. You take me, you pour all of you in me. I give better results. But when you try to take a LPN and try to change them, oh baby, that's the word. It's so worse because they've been doing things for a lot of years. Who are you to change? They go, don't beg. They go, don't beg until they change. It's not like how you took your test. This test changed 10 times harder. It changed. All right? Okay. Urinary retention. Yes. I cannot pee. Make me pee. Be careful. Foley. Last result. Last result. What are you going to do first? Pull my hair. Turn the water. Make me walk. Stroke my thigh. Turn the faucet on. Foley, last result. Condom catheter. Who put it on? CNA. Straight cat. CNA. Straight cat is PP2. Remove it. Foley. LPN, RN. CNA can straight cat. Why you look at me so? Straight cat is who? Get a urine take out. How many of you guys did your clinicals in a hospital? Anytime you do clinicals in a hospital, you see some of the stuff I'm talking about. How many of you guys never did clinicals nowhere? The school you go to don't have a clinical site. You went to rehab. LPN only go to rehab. Okay.
So, but this CNA, they have special training in the hospital. They call it
PCT, you don't get no special training. You get the same training. It's just a CNA in the hospital more advanced. Parce que you wear more. They see more. Who's an LPN and work in a hospital? You're an LPN, you work in a hospital? Where do you work?
South Florida State Hospital.
Okay. So you do a lot of stuff. A lot of stuff. Right? Who at LPN never work in a hospital? Who at LPN you only work rehab? Who at LPN that only do homes?
But I used to work in the hospital.
Right.
Worst mistake. Do not be in a hospital, LPN if you do not like Kaimu. Wrong direction. Don't work unless it's your home and you got patient in. You don't learn nothing. You just a high-paying HHA. You need to go work in rehab, LPN. I'm telling you. You don't, and I have a lot of them in my review. That's why it's a lot of stuff that LPN don't know. Okay? I know you got to hustle, make your money, but you can do 2 jobs. You can teach too as an LPN. You know that. You can teach as an LPN instructor in a clinical, but you got to be an LPN for years. I won't hire you, but you know. No, I'm just kidding. But you can work in a facility. So you work in a rehab for 3 days et pour travailler pour l'école des jours, faire l'argent. Don't go work in people's home. Quit that job, girl. I'm going to give you an agency number to call. You don't need to be working in nobody's house. Hell no. Another. Constipation. Patient is constipated. Walk, eat fiber. Fluid. Why after surgery? Let me ask you a question. After surgery, when do you hear vowel sound? So let me give you a question. 2 hours after surgery, you came in the room. Marty, you listen to bowel sounds. Marty doesn't have any bowel sound. What is your initial nursing intervention? Call the doctor, take Marty temperature, ask Marty to walk, or document that as normal. 2 hours. You gonna tell him to walk? 2 hours.
Blood pressure fall. Anesthesia.
Post-op, the anesthesia. You're going to document that as normal. 8 hours. You would have got that? No critical thinking, that's a level 2 question. You ain't getting no $50 for this. Okay, now, 8 hours post-op. No bowel sound, distended, fever, chills. What is that called? What is that called? Peritoneal. Medical? Yes. Any question? Make sure you know that. That's why you give them which diet? Or after surgery, what's the first diet? Clear liquid. Clear liquid. Is ice chip considered clear liquid?
Yes.
Yes. Clear liquid, and then we move on to what? Full liquid, and then you go into what? Soft, and then regular diet. The patient comes to your floor, and the doctor did not write an order for the diet. The patient came to the tele floor, and the doctor did not write a diet order for the patient. What is your initial nursing intervention? Give the patient a regular diet. Call the supervisor. Call the doctor or call the dietitian. The patient came to the tele floor, and the doctor did not order a diet. What is your initial nursing intervention? This is an NCLEX question. Ready? Call the doctor. Call the supervisor to give you an order. Call the dietitian, right? Or you give the patient a regular diet. Think, critical thinking. What was the key word in the question? I didn't say after surgery. I said the patient came on the tele floor. So what's the key word?
Tele floor,
Tele floor, which is your heart floor. You need to call the doctor. Now, patient comes to the med-surg floor, and the doctor did not order the diet. What is your initial nursing intervention? Call the doctor. You give regular diet. Call the supervisor, right? Or call the dietitian. Med-surg.
The doctor still has to give it, but
You will order a regular diet. Let me change the question again. The patient came to the floor, med-surg floor, with nausea and vomiting. The doctor, and feel. Anytime you come in, and feel. Let me switch the question. The patient came on the med-surg floor with a creatinine of 2. 2. The doctor ordered a low sodium diet for the patient. Will you give it? Call the supervisor. Call the doctor. Call the doctor so he can give you another order, or call the nutritionist.
call the doctor.
Call the doctor to give you another order, because anytime patient have kidney problem, the patient is on NPO. Anytime a patient comes with a creatinine high, that means the kidney low, they must be NPO. After you put the patient on NPO, what's the next order? NG2. Good job. I said NG2. What? NG2. Why? Lavage. Anytime I'm nausea, vomiting, kidney elevated, NPO, NG2.
That's what it said. And we saw that sometimes the creatinine is high because the patient didn't drink enough.
Girl, let's look at that. Creatinine is high because the patient didn't drink. What will tell us the patient is dehydrated? What will tell you the patient is dehydrated? The B and the what?
The skin.
What would we find in the urine? Ketones. Ah, we did that last week. Guys, go take critical thinking. Yo, ketones we'll find in the urine. Okay? Now, ketones in the urine and the sugar is not high. Are you diabetic ketoacidosis?
No.
Ketones in the urine. Sugar is high. What are you? Diabetic ketoacidosis. Which diabetic you are? Type 1 or type 2?
Type 2.
Type 1.
Ketone.
Diabetic
Oh, yeah. Type 1.
All right. Then we go to the 2 wounds. Wound dehiscent and wound evacuation. What am I going to do to prevent this? Incision and splitting. Yes. The first one, how would you dress the nurse? A patient have this. How would you dress the nurse? How would the nurse dress for the first one? Dehiscent me vledi ma langue lan pété. How would you dress? Let's work on the nurse first and then we'll work on the patient. How would you dress, baby? Not the patient, not the dressing change. How you, the nurse, would dress.
Gloves. You don't need gloves.
Glove, gown,
No.
and mask.
Why? What mask?
So it'll be, now I heard gloves. Sterile. Because il ouvert, ma langue lan ouvert. You, the nurse, sterile glove. Now, what type of dressing you will put in patient? First, we're going to wash it with what? Normal saline. So, look, when I wash it, clean it, what kind of glove I'm going to wear? Normal glove. Normal. To wash it, to clean it. Normal saline, clean, throw away the glove. I wash my hand. Now I am going to put the sterile gauze. I need what? Sterile glove. I'm going to go put the sterile gauze. I need sterile gloves. So NCLEX going to ask you to open the sterile field. Which is in your skill sheet. In your skill. What is on me? Now, we go. Then NCLEX asks you, position me. Patient. Now remember, IPT, position me. If flat way, remember the 3 little puppies? Yeah. Now, I'm sitting high follow. After you put your dress in, Where's the pillow should be? On my stomach. Suppose Carl won't come put a pillow on my back. He put pressure. She needs further. Good job. Do you understand? Now, the bottom one. It's called evacuation. Konya malay, ouvert, moelle, sorti. Dress. Just like you going to the moon. What type of dressing we put here? Wet to dry. Kisa, moelle la kisa. The tissue, darling, it's out. So you got to keep it wet, boys. Now, so the position's still the same. Wet to dry dressing. There's something the doctor going to do with that patient. What is he going to order? Antibiotics. And a lot of fluid. Est-ce qu'il nous comprend? Nice and organized. Right? Yes, Robin, question? Okay. Robin got her $25. Her Monique shared. Hey, baby, I owe you $50. So I want you so you can have a good weekend. You know? Okay, so look. Next week, nice. Wednesday when you be here, don't go, what? Alzheimer's, death and dying, we done, son.